Hi, my name is Taylor Johnson, and in today's video we will be talking about inappropriate antidiuretic hormone secretion. So, SIADH is where the patient produces too much antidiuretic hormone. This is a condition in which high levels of hormones cause the body to retain an amount of water. This condition usually occurs in the older population. The most common cause is cancer, specifically small cell lung cancer, but other causes are other cancers such as pancreatic, prostate, thymus, and lymphoid. Also CNS disorders such as brain tumors, head injuries such as skull fractures or subdural hematomas, a stroke, meningitis. The other cause is drug therapy, and those examples are chemotherapy agents, opioids, oxytocin, SSRI antidepressants, and thiazide diuretics. The last cause of SIADH is miscellaneous causes, and those include HIV, hypothyroidism, lung infections such as pneumonia, and COPD. SIADH can become chronic if the cause is due to tumors or metabolic disorders. So, when this patient has SIADH, the patient deals with a low urine output, which also entails an increased body weight due to the amount of fluid the patient is retaining. The clinical manifestations the patient will experience in the early ages are dyspnea, fatigue, excessive thirst. In SIADH, the patient's sodium level begins to decrease, and whenever the sodium level goes beneath 120, that is when the symptoms become severe. These symptoms begin with vomiting, abdominal pain and cramping, muscle twitching, cerebral edema, confusion, seizures, and lethargy. So, the medications for SIADH determine on what the patient's clinical manifestations are, as well as what their lab values are. If their serum sodium is greater than 125, their treatment is fluid restriction of 800 to 1,000 milliliters per day. If the patient may also be prescribed a loop diuretic to promote diuresis. Another medication is a vasopressor receptor antagonist, which will be given due to the blocking the activity of the antidiuretic hormone. So the FDA has approved 2 medications, and those names are conivaptan and tolvaptan. So the nursing interventions for SIADH begin with monitoring the patient's intake and output, their vital signs, heart and lung sounds, and obtain daily weights for the patient. The nurse may also observe signs for hyponatremia, which include seizures, headache, vomiting, and decreased neurological function. The nurse will also implement fall and seizure precautions for the patient. So, one of the clinical manifestations is thirst, and some ways a nurse can help the patient with this symptom is by providing ice chips or either getting sugarless gum, and that helps with the patient to become less thirsty. So when SIADH occurs in the system, it affects the kidneys. The antidiuretic hormone helps the kidneys control the amount of water that is being excreted through the patient's urine, which then leads to hyponatremia. Since SIADH allows the serum sodium levels to be low, this will have the patient's complications with this condition consist of memory problems, depression, respiratory failure, as well as hallucinations. And that concludes my video on SIADH. Thank you so much.